Intersectionality theory recognizes that a person's experiences in the world are shaped by multiple interconnected factors. The unique challenges that affect the deaf and LGBTQ communities separately are further compounded as an intersectional social position. This poster focuses on intersectional difficulties that impact access to and the quality of services provided to the deaf and LGBTQ communities, and advances points of intervention to address barriers. Roughly 3.6% of U.S. adults identify as deaf, 7.2% identify as LGBTQ, and about 10% of the deaf population also identify as LGBTQ. Roughly 5% of deaf U.S. youth identify as LGBTQ. ASL is the native language for about 3% of the U.S. population. Now, due to reporting challenges for both communities, these numbers may actually be larger. Additionally, LGBTQ and deaf individuals report higher levels of abuse, harassment, discrimination, and suicidality, as well as lower levels of family support. Deaf individuals are 3 to 5 times more likely to report serious emotional distress, about 7 times more likely to have inadequate health literacy, and less than 2% of deaf individuals in need of mental health treatment receive care. These communities face barriers to mental health service access, such as stigma, bias, and discrimination, clinicians who lack cultural competency with LGBTQ and or deaf culture, discriminatory laws and policies, communication disparities, financial concerns as both communities are underemployed, suboptimal past experiences that affect trust, lack in supportive resources, shortages of clinicians fluent in ASL, technology, and standardized tests and measurements are often designed for hearing people and are often invalid when used with deaf individuals. Deaf clients are more appropriately served by clinicians who are fluent in ASL, but this is not always possible, and clinicians may need to work with interpreters. However, there are possible challenges with relying on interpreters. The interpreter may not have the clinical skills needed to interpret nuanced underlying meanings. Having an additional person in the therapy room may result in actual or perceived loss of privacy. It can be difficult to coordinate scheduling between 3 individuals. Clients may feel stress and anxiety with the uncertainty if interpreters will be accepting and affirming of LGBTQ identities. There is a potential for interpreters affecting the therapeutic relationship. With the smaller nature of both communities, there is increased risk of dual relationships. It may require extra time and training for both the therapist and the interpreter. Language disconcordance is associated with lower levels of disclosure, treatment compliance, and health literacy, and underqualified interpreters can lead to diagnostic errors. Some recommendations for working with interpreters include clarifying the roles and expectations for both the therapist and interpreter, emphasizing the importance of maintaining confidentiality and impartiality, acknowledging the potential discomfort of discussing personal and sensitive issues through an interpreter. Allow time for the client to build trust with both the therapist and the interpreter. Use only interpreters who are accepting and affirming of LGBTQ identities and who are culturally competent with both the deaf and LGBTQ communities. Use interpreters with experience in mental health settings to ensure they understand the sensitivity and nuances of the conversations and are highly skilled with therapeutic language. Periodically check with the client to ensure they understand the interpreted information accurately, and encourage the interpreter and client to ask for clarification if there's any confusion. Remind the interpreter to remain neutral and avoid personal opinions and biases. Address any issues related to the interpreter's behavior that may impact the therapeutic relationship. And recognize that interpretation may take longer, so schedule sessions accordingly. Some recommendations for addressing barriers include providing cultural competency training specific to the needs and experiences of the LGBTQ and deaf communities. Provide outreach and education programs to increase awareness and understanding of the mental health challenges faced by LGBTQ and deaf individuals. Create LGBTQ affirming and deaf-friendly spaces within mental health offices. Advocate for and support legislation that protects the rights of LGBTQ and deaf individuals. Offer community-based services and support groups specifically designed to meet the needs of the LGBTQ and deaf communities. Increase the training of LGBTQ and deaf mental health care providers. Provide access to interpreters or care providers fluent in ASL. Involve LGBTQ and deaf communities as active participants and meaningful contributors in all steps of intervention, design, and implementation. Recognize and address the intersectionality of identities. Expand telehealth services to include online therapy and virtual support groups. Partner with LGBTQ and deaf community organizations. Incorporate deaf culture awareness into counseling training curriculum. Provide multiple communication options such as interpreters, video relay services, closed captioning, and written communication. And create valid and reliable tested measurements designed for deaf individuals.